Ultimate Mental Health Promotion Practice Guide. Question 1. Child Protective Services have removed 10-year-old Christopher from his parents' home due to neglect. Christopher reveals to the nurse that he considers the woman next door his nice mom, that he loves school, and gets above average grades. The strongest explanation of this response is Option A. Temperament. Option B. Genetic factors. Option C. Resilience. Option D. Paradoxical effects of neglect. The correct answer is Option C. Resilience. Christopher's positive outlook, strong school performance, and forming a bond with the neighbor indicate resilience. Resilience refers to the ability to adapt and thrive despite facing adversity, such as being. Question 2. James is a 42-year-old patient with schizophrenia. He approaches you as you arrive for the day shift and anxiously reports, "Last night, demons came to my room and tried to rape me." Which response would be most therapeutic? Option A. There are no such things as demons. What you saw were hallucinations. Option B. It is not possible for anyone to enter your room at night. You are safe here. Option C. You seem very upset. Please tell me more about what you experienced last night. Option D. That must have been very frightening, but we'll check on you at night and you'll be safe. The correct answer is Option C. You seem very upset. Please tell me more about what you experienced last night. Response C is the most therapeutic as it shows empathy and encourages the patient to express their feelings and share more about their experience. By actively listening and inviting the patient to talk, the nurse. Question 3. Which statement made by the patient demonstrates an understanding of the effective use of newly prescribed lithium to manage bipolar mania? Select one that doesn't apply. Option A. I remind myself to consistently drink 6 12-ounce glasses of fluid every day. Option B. I discussed the diuretic prescribed by my cardiologist with my psychiatric care provider. Option C. Lithium may help me lose the few extra pounds I tend to carry around. Option D. I take my lithium on an empty stomach to help with absorption. The correct answer is Option C. Lithium may help me lose the few extra pounds I tend to carry around. Rationale. Question 4. Which intervention is most appropriate for a patient with a phobia of flying? Option A. Exposure therapy. Option B. Cognitive restructuring. Option C. Medication management. Option D. Psychoeducation. The correct answer is Option A. Exposure therapy. Exposure therapy is considered the most appropriate intervention for a patient with a phobia of flying. This therapeutic approach involves gradually exposing the individual to the feared stimulus, in this case. Question 5. During a manic episode, which nursing intervention is most appropriate? Option A. Encourage group activities to increase socialization. Option B. Provide a structured environment with limited stimuli. Option C. Allow the patient to engage in physical activities freely. Option D. Give the patient detailed and complex tasks to complete. The correct answer is Option B. Provide a structured environment with limited stimuli. During a manic episode, individuals may experience heightened energy levels and reduced impulse control. Providing a structured environment with limited stimuli is the most appropriate nursing intervention. Question 6. What principle about patient-nurse communication should guide a nurse's fear of saying the wrong thing to a patient? Option A. Patients tend to appreciate a well-meaning person who conveys genuine acceptance, respect, and concern for their situation. Option B. Patients are more interested in conversing with you than in hearing your perspective, making offense unlikely. Option C. Considering the patient's background, the likelihood of the comment causing harm is minimal. Option D. Individuals with mental illness often possess a heightened capacity for forgiveness. The correct answer is Option A. Patients tend to appreciate a well-meaning person who conveys genuine acceptance, respect, and concern for their situation. The correct answer is A. Patients value interactions with healthcare providers who express genuine acceptance, respect, and concern for their well-being. By focusing on conveying these qualities, a nurse can help. Question 7. Which medication is commonly prescribed for the treatment of panic disorder? Option A. Haloperidol. Option B. Clonazepam. Option C. Lithium. Option D. Fluoxetine. The correct answer is Option B. Clonazepam. Clonazepam, a benzodiazepine, is commonly prescribed for the treatment of panic disorder due to its anxiolytic properties. It helps reduce the frequency and intensity of panic attacks by acting on the central nervous. Question 8. Therapeutic communication is the foundation of a patient-centered interview. Which of the following techniques is not considered therapeutic? Option A. Restating. Option B. Encouraging description of perception. Option C. Summarizing. Option D. Asking why questions. The correct answer is option D, asking why questions. Asking why questions is not considered a therapeutic technique in patient-centered communication, as it can make patients feel defensive or judged. Why questions may imply criticism or put the patient on the spot. Question 9. A male patient calls to tell the nurse that his monthly lithium level is 1.7 milliequivalent/L. Which nursing intervention will the nurse implement initially? Option A. Reinforce that the level is above the therapeutic range. Option B. Instruct the patient to hold the next dose of medication and contact the prescriber. Option C. Advise the patient to go to the hospital emergency room immediately. Option D. Inform the patient about the possibility of seizures and appropriate precautions. The correct answer is option B. Instruct the patient to hold the next dose of medication and contact the prescriber. A lithium level of 1.7 meql is above the therapeutic range, indicating a potential risk of toxicity. The initial nursing intervention should be to instruct the patient to hold the next dose of medication and. Question 10. A patient with obsessive-compulsive disorder, OCD, is performing a ritualistic handwashing routine. What is the nurse's best initial response? Option A. Interrupt the ritual to help the patient gain control. Option B. Allow the ritual but set limits on the duration. Option C. Ignore the behavior to avoid reinforcing it. Option D. Encourage the patient to stop the ritual and discuss their feelings. The correct answer is option B. Allow the ritual but set limits on the duration. In managing a patient with OCD engaging in ritualistic behaviors like handwashing, the nurse's best initial response is to allow the ritual but set limits on the duration. This approach helps in managing the behavior. Question 11. When patients diagnosed with schizophrenia suffer from anosognosia, they often refuse medication, believing that Option A. Medications provided are ineffective. Option B. Nurses are trying to control their minds. Option C. The medications will make them sick. Option D. They are not actually ill. The correct answer is option D. They are not actually ill. Anosognosia is a lack of insight that affects patients with schizophrenia, leading them to deny or lack awareness of their illness. This lack of awareness often results in patients refusing medication because they. Question 12. Which activity is most appropriate for a child with ADHD? Option A. Reading an adventure novel. Option B. Monopoly. Option C. Checkers. Option D. Tennis. The correct answer is option D. Tennis. Children with ADHD often struggle with sustained attention, impulsivity, and hyperactivity, making it essential to select activities that align with their neurological needs while minimizing frustration. Tennis D. Question 13. A nurse is reviewing prescriptions for a patient with major depression at the county clinic. Since the patient has a mild intellectual disability, the nurse would question which classification of antidepressant drugs. Option A. Selective serotonin reuptake inhibitors. Option B. Monoamine oxidase inhibitors. Option C. Serotonin and norepinephrine reuptake inhibitors. Option D. All of the above. The correct answer is option B. Monoamine oxidase inhibitors. Monoamine oxidase inhibitors are less suitable for patients with intellectual disabilities due to the need for dietary restrictions and close monitoring. These restrictions can be challenging for patients with mild. Question 14. A patient with major depressive disorder is started on venlafaxine. Which class of antidepressant does this medication belong to? Option A. Selective serotonin reuptake inhibitors, SSRIs. Option B. Tricyclic antidepressants, TAS. Option C. Monoamine oxidase inhibitors, MAOIs. Option D. Serotonin norepinephrine reuptake inhibitors, SNRIs. The correct answer is option D. Serotonin norepinephrine reuptake inhibitors, SNRIs. Venlafaxine is classified as a serotonin norepinephrine reuptake inhibitor, SNRI. SNRIs work by increasing the levels of both serotonin and norepinephrine in the brain, which helps alleviate symptoms of depression. Question 15. A patient diagnosed with bipolar disorder is experiencing a depressive episode. Which medication is commonly prescribed for this phase of the disorder? Option A. Valproic acid. Option B. Risperidone. Option C. Fluoxetine. Option D. Lithium. The correct answer is option C. Fluoxetine. The correct answer is C. Fluoxetine. Fluoxetine, a selective serotonin reuptake inhibitor (SSRI), is commonly prescribed to manage the depressive episodes in bipolar disorder. SSRIs are effective in treating the. Question 16. Kyle, a patient with schizophrenia, began taking the first-generation antipsychotic haloperidol, Haldol, last week. One day you find him sitting very stiffly and not moving. He is diaphoretic, and when you ask if he is okay, he seems unable to respond verbally. His vital signs are BP 170/100, P 110, T 104.2 degree F. What is the priority nursing intervention? Select one that does not apply. Option A, hold his medication and contact his prescriber. Option B, wipe him with a washcloth wet with cold water or alcohol. Option C, administer a medication such as benztropine IM to correct this dystonic reaction. Option D, reassure him that although there is no treatment for his tardive dyskinesia, it will pass. The correct answer is option C, administer a medication such as benztropine IM to correct this dystonic reaction. The patient's symptoms, including stiffness, diaphoresis, inability to respond verbally, and vital sign abnormalities, are indicative of neuroleptic malignant syndrome NMS, a serious and potentially. Question 17. In what order should the following goals be approached for a client being treated for alcoholism? Option A, learning about dependence and recovery, abstinence and development of a support system, attaining physiological stabilization, developing alternative coping skills. Option B, developing alternative coping skills, attaining physiological stabilization, learning about dependence and recovery, abstinence and development of a support system. Option C, abstinence and development of a support system, attaining physiological stabilization, learning about dependence and recovery, developing alternative coping skills. Option D, abstinence and development of a support system, learning about dependence and recovery, attaining physiological stabilization, developing alternative coping skills. The correct answer is option B, developing alternative coping skills, attaining physiological stabilization, learning about dependence and recovery, abstinence and development of a support system. When treating a client for alcoholism, it is important to follow a structured approach to maximize treatment effectiveness. The correct order of approaching goals is to first help the client in developing alternative. Question 18. The school nurse has been alerted to the fact that an 8-year-old boy routinely play acts as a police officer, locking up other children on the playground to the point where the children get scared. The nurse recognizes that this behavior is most likely an indication of Option A, the need to dominate others. Option B, inventing traumatic events. Option C, a need to develop close relationships. Option D, a potential symptom of traumatization. The correct answer is option D, a potential symptom of traumatization. The behavior of an 8-year-old boy play acting as a police officer and locking up other children to the point of scaring them is likely a symptom of traumatization. Children may reenact traumatic experiences through. Question 19. Pablo is a homeless adult who has no family connection. Pablo passed out on the street, and emergency medical services took him to the hospital where he expresses a wish to die. The physician recognizes evidence of substance use problems and mental health issues and recommends inpatient treatment for Pablo. What is the rationale for this treatment choice? Select one that doesn't apply. Option A, intermittent supervision is available in inpatient settings. Option B, he requires stabilization of multiple symptoms. Option C, how do you feel about talking to a mental health counselor? Option D, medication adherence will be mandated. The correct answer is option D, medication adherence will be mandated. The correct answer is D because medication adherence being mandated is not a primary rationale for inpatient treatment. The main reasons for recommending inpatient treatment in this scenario include the need for. Question 20. A patient with generalized anxiety disorder, GAD, is prescribed buspirone. The nurse understands that buspirone is different from benzodiazepines because it, Option A, has a high potential for abuse. Option B, works immediately to relieve anxiety. Option C, does not cause sedation. Option D, is used for short-term treatment only. The correct answer is option C, does not cause sedation. Buspirone is different from benzodiazepines because it does not cause sedation. Unlike benzodiazepines, buspirone has a lower potential for abuse and does not cause the sedative effects commonly seen with. Question 21. When attempting to determine a teenager's mental health resilience, what assessment question should the nurse ask that is not applicable? Option A. How did you cope when your father deployed with the army for a year in Iraq? Option B. Who did you go to for advice while your father was away for a year in Iraq? Option C. How do you feel about talking to a mental health counselor? Option D. Why would you think that is a better option than meeting with me? The correct answer is option D. Why would you think that is a better option than meeting with me? Assessing a teenager's mental health resilience involves exploring coping mechanisms, support systems, and attitudes towards seeking help. Option D is not relevant to assessing resilience but rather focuses on the. Question 22. Which patient should be most carefully assessed for fluid and electrolyte imbalance among those receiving the following drugs? Option A, lithium escalate. Option B, clozapine, clozaril. Option C, diazepam, Valium. Option D, amitriptyline. The correct answer is option A, lithium escalate. Lithium escalate is the correct choice because it has a narrow therapeutic index and is excreted almost entirely by the kidneys, making patients highly susceptible to fluid and electrolyte imbalances. Lithium. Question 23. When providing care for 10-year-old Harper diagnosed with post-traumatic stress disorder, PTSD, which goal should be addressed initially? Option A, Harper will be able to identify feelings through the use of play therapy. Option B, Harper and her parents will have access to protective resources available through social services. Option C, Harper will demonstrate the effective use of relaxation techniques to restore a sense of control over disturbing thoughts. Option D, Harper and her parents will demonstrate an understanding of the personal human response to traumatic events. The correct answer is option C, Harper will demonstrate the effective use of relaxation techniques to restore a sense of control over disturbing thoughts. The initial goal when caring for a child with PTSD like Harper is to address restoring a sense of control over disturbing thoughts by teaching relaxation techniques. This approach helps the child manage their. Question 24. Which intervention should the nurse implement when caring for a patient demonstrating manic behavior? Select one that doesn't apply. Option A, monitor the patient's vital signs frequently. Option B, keep the patient distracted with group-oriented activities. Option C, provide the patient with frequent milkshakes and protein drinks. Option D, reduce the volume on the television and dim bright lights in the environment. The correct answer is option B, keep the patient distracted with group-oriented activities. When caring for a patient demonstrating manic behavior, it is crucial to monitor vital signs frequently to ensure the patient's physical health is stable, providing nutrition, such as milkshakes and protein drinks. Question 25. In the care plan of a male patient diagnosed with a dissociative disorder, the nursing diagnosis of ineffective coping is included. Which behavior demonstrated by the patient supports this nursing diagnosis? Option A, has no memory of the physical abuse he endured. Option B, using both alcohol and marijuana. Option C, often reports being unaware of surroundings. Option D, reports feelings of not really being here. The correct answer is option B, using both alcohol and marijuana. The correct answer is B because using substances like alcohol and marijuana can be a sign of ineffective coping mechanisms in patients with dissociative disorders. Substance abuse is often used as a maladaptive way